This is one of my favorite pictures of Janelle. My wife has always been really super active. I mean, always wanting to go, and have people around. That's the most important thing to her.
I love being a grandmother.
Hi!
I was able to watch all 5 of my grandkids as they grew up. I took care of them, and I had them every summer, all 5 of them, for years, and it was the best time of my life.
Oh, I thought you got it. Because the green. Okay, I'll get next.
I have always been very avid about fitness and just being the best I could be, especially for the grandkids, because they're a lot of work.
She's always been a great wife. She's beautiful, and she's a very loving woman, so I've been very lucky. I mean, she was 17 when we got married. We had our first kid, that kind of thing, but, it was a blessing. It was meant to be.
In 2019 is when I started to notice that I was having trouble.
All of a sudden, she couldn't pivot at times, pivot without shaking or walking funny.
During this time, I could not get up steps by myself.
Her health would just she'd just have more symptoms of things going wrong.
My name is Janelle, and I have Lambert-Eaton Myasthenic Syndrome, also known as LEMS.
Normally, our immune system is developed to attack those things that shouldn't be there, like viruses, bacteria. But in autoimmune disease like LEMS, it decides that a protein on a nerve cell is foreign and decides to mount a full-blown attack on that protein.
Well, the first thing that I really noticed after getting out of the chairs was my front step. And I could not get up the front step at all. So that's when I really got scared and went to the doctor.
Not only do patients have fatigue and weakness, but they can have dry mouth, constipation, lightheadedness. Their eyes don't constrict when light shines on them, so they have blurred vision. So it can go undiagnosed because many of these symptoms are not specific for LEMS. So often patients go undiagnosed for a while. In terms of diagnosis, it really requires a couple of tests: a good exam, a good history, and then there's a couple of tests which require us to look at the muscle in the nerve. And we can actually measure the muscle fatigue and weakness objectively. Now, Lambert-Eaton is unique in that not only do we show that the nerve and muscle function is abnormal, but what's interesting about this disease and almost diagnostic is that if you exercise a patient for a short time, they'll actually become significantly stronger. It's called the Lambert sign, after Dr. Lambert, who was one of the first doctors to describe the disease.
I had CT scans, I had x-rays of my lungs, I had EMGs, and I would go back to him every 3 months. And then he took 23 vials of blood and scheduled me for an MRI to look for lesions on my brain.
Then the falling started, and that's when it really got concerning.
LEMS is an underdiagnosed disease because, number one, it's rare. So many physicians, including neurologists who take care of the disease, miss it. It's 46 times less common than the most common myasthenic syndrome. So when we think about myasthenic syndromes, LEMS is one of them. The most common one is called myasthenia gravis, which can look very similar to LEMS. What distinguishes myasthenia gravis from LEMS is that we don't typically have the dry mouth, the constipation, some of those automatic symptoms or problems. And often in myasthenia gravis patients, they present with eye problems before they present with muscle problems in the legs and arms. They'll present with double vision or their lid may droop. Whereas with LEMS, it often presents in the legs, goes to the shoulders and the neck, maybe the face.
The doctor rules out MS, no lesions on my brain, and he then said, I have an antibody in my blood that's small cell lung cancer. Sorry.
What's worrisome about this disease is that over 50% have an undiagnosed tumor that probably is causing the immune system to act abnormally. And so that's one of the biggest risks with this disease is undiagnosed cancer, which can be there months to years before someone can diagnose it.
I remember we went out to eat afterwards and I started looking up Lambert-Eaton and I was devastated with what I was reading. There's no cure at all for this. And we need to check for the lung cancer every 3 months.
The other risk is that it really impairs quality of life. Patients can't do the things they normally could do. They have to retire early. They can't take care of their kids. In severe forms, they can't even wash their hair or get dressed. And in rare forms, it can affect the muscles of breathing, which can cause major issues and often can result in being hospitalized.
It's hard to watch somebody suffer. And this is a person that, man, go. And not being able to go was very frustrating to her. And she's the kind of person that she doesn't want someone helping her. She doesn't want someone doing things for her. So she's very resistant to it at first and still is to this day a little bit. It's very hard to watch.
Because it is an autoimmune disease, most autoimmune diseases require therapies or medicines that calm the immune system down.
First medication she was on was for people in Vietnam that came in contact with Agent Orange, and it was so rough on her. Literally, she'd take a pill and her lip would start quivering and her hands would start moving and twitching on the face.
I could not walk without holding on to walls, and if I got on the floor, I could not get up by myself.
There are steroids that have been used. There are proteins that sort of decrease the inflammation called IVIG. There's even pills or chemotherapy that we've used in low doses. So we call these immune suppressants or modifiers.
I came home and she's like swimming in the pool. I hadn't seen that for a long time.
And I could walk alone, which I had not been able to do for months.
So it was really cool. And the doctors, they always told us from day one, he said, it's not a cure, but I think the medicine gave her 2 years of more moving.
So in Lambert-Eaton, the antibody is affecting the calcium channel. I call it the door to the nerve. So normally that antibody blocks the door. The chemical acetylcholine cannot come out. What this new medicine does is it overstimulates the nerve so that it pushes the door open. It overstimulates the nerve so that more of this acetylcholine pushes its way out into the space.
This medication only works for 4 hours, and then I take another pill. So I take 2 pills 4 times a day. So mornings are still rough for me because I've gone hours without the medication.
Like with many diseases, chronic diseases that patients face, LEMS is no different. It changes your life and it forces a new normal on patients. But as long as patients can navigate that with the support of their family and their loved ones and their healthcare provider, most do find quality of life and hope, even when they're facing this disease.
Every morning I get up, I think that I am my old self. As I wake up, in my mind I am. And then I get up and I try to move, and it's not well. And then I look in the mirror and I see I'm not what I used to be.
She's a fighter. She doesn't want to quit. She gets mad at herself, but she doesn't see that her soul is great. And what is taken from her is her confidence and her smile.
This one was Mom and Dad's. People started to come over and visit me. And I think that the friends and the people that are closest to me really helped me forget about things. It's friends and family that have brought me out.
I believe God can do anything, and who knows what's going to come.
That was the best.
There's Noah.
There's me.
Okay, there's you.
Yeah. Smiling in that one. I'm not smiling in that either.
I think this is the new me. This is just what I'm going to be from now on. And I had to really come to terms with that.
We just got to keep moving forward and then try to enjoy the day. Hopefully she can keep mentally strong and help somebody through this.